The Department of Veterans Affairs is committing $818 million in grants to combat veteran homelessness. Joining us now to discuss is retired U.S. Marine Corps Major Chris Lovell, CEO and founder of Lovell Government Services. Good afternoon, Major Lovell. How much of an impact do you expect this grant money to have on veteran homelessness nationwide?
Good afternoon, Don, and thanks for having me on to talk about this important issue. It's I think the $818 million is just another great win for the battle against veteran homelessness. And it's one veteran is too many on the street. But the good news is the veteran homeless population has decreased drastically since 2010. And the population that we know is about 32,882. And this $818 million that is going to be dispersed throughout around 235 organizations that focus on helping veterans get back on their feet is a great step to reducing that veteran population even more.
So, Major, from your perspective, with working directly with veterans, what are some of the factors that make them vulnerable to homelessness that are different from the general public?
Sure, great question. There's a lot of factors. Obviously, everyone's different. They'll have their different circumstances, but one of the largest factors that we see is that it's mental health struggles, right? PTSD, anxiety, followed by substance abuse, in various forms. Sometimes it's just really when you leave the service, a lot of veterans don't realize how much of a community that they have. It's almost like a family. And so when you leave a cohesive unit that you had shared experiences with, and you leave and go back to wherever you choose to go, you don't have that support network anymore. And so there's this, they feel like they're not connected. And so a lot of combinations of those things, social isolation, it just kind of compounds. And so they find themselves in a temporary spot. They're homeless. And the good news is the VA has been doing great things for years to address the problem.
So maybe we can talk about that. How do you address the root causes of homelessness rather than just a temporary fix?
Sure. A lot of times it happens on the local personal level, right? We like to say you love on that veteran, right? Whether it's a man or a woman that's in the street who's really maybe just down on their luck, struggling with different things. It's addressed on the local level. I don't think you're ever going to get rid of substance abuse. It's always going to be an issue. It seems like veterans struggle with it sometimes more than the general population. But at the end of the day, it's that human connection. And I think the great part of these grants is going to local charitable organizations that focus on homelessness, specifically targeting veterans.
What would you say, in your experience, are some of the barriers, perhaps internally or externally, that might prevent veterans from reaching out for help when they need it?
Sure, Don. I mean, veterans are just proud people, right? Sometimes it's hard to humble yourself and ask for help. And the good news is for those veterans who can't, these organizations are seeking them out to let them know that they're appreciated, their service was appreciated, and that they deserve the care that they earned during their service. And so this is a great step forward.
So you've seen a lot in your time helping veterans, and what are some of the success stories that are potentially motivating? Perhaps you can share with us. You've seen in veterans that you've helped to get back on their feet.
Sure, we help literally thousands of veterans every month with the medical care that veterans get throughout the 171 veteran centers throughout the country. And there's so many success stories. How much time do we have, Don? We could talk, but I have veterans that will just call me and say, "Hey, Chris, I'm struggling with some anxiety. I'm having some problems with getting this device. I'm wait time maybe at the VA. Maybe they have an appointment the following week. We'll FedEx them, an anxiety device called the Calm Ego, and it's a small device like an albuterol inhaler, but it's over the counter." and it just lets them know that somebody cares about them. It's something they can hold in their hand. It helps them to reduce their anxiety. It's super low cost, and we do this on a regular basis for hundreds of veterans every month.
Do you think there are some other common struggles that veterans perhaps are facing beyond housing?
I think, yeah, the veterans are just like everyone else, Don. We all struggle with different things. Personal issues, family issues, substance abuse, things like that. And the great news about all this is that veterans have an amazing amount of resources. And in August, the VA marked their 29 millionth home loan guaranteed backed by the VA home loan program. Since the program started in 1944, that program alone is helping veterans stay in their homes. And the president just signed into law, HR 1815, which is the Reform Act for veteran home loans, which allows the VA to, if a veteran's struggling, they can back the debt for the veteran and keep them in the home longer. And what a lot of folks don't realize is sometimes veterans are actually in the veterans hospital getting care when they miss their mortgage payment. So it allows the VA, the Veterans Administration, to take care of that debt. It could be temporarily. The veteran can pay back the VA if he chooses to, or if he doesn't, then that's just it's taken care of and taken care of during the sale of the house whenever that happens, whenever the house is sold. So a lot of great programs that Secretary Collins has worked with in just the last few months to help keep veterans, so many resources to keep veterans off the streets and in a great place and on a path forward.
So earlier you said that you help 1,000 or more veterans each month. Honestly, that is very surprising in a good way. It's incredible what you're doing here. What gives you optimism about the future? What motivates you to do what you keep doing?
Don, what motivates me is, after 24 years of service in the Marines, I want to continually be around veterans and support veterans. And it gives me sense of purpose and to be able to interact with veterans, to still, we employ out of our 40 employees, 80% are veterans. Most of them are disabled veterans themselves. And just connecting with other veterans throughout the country, letting them know that, hey, we're still here. You may not be on active duty anymore, but we still care. We're still here, and we want to make sure that you're in a good place and that you're taking advantage of the benefits that you've earned. Whether some don't realize that they do have benefits out there and resources that are available to them to help them if they're struggling. And so it's just a rewarding part of what we do. We're happy to be a small part of what the VA does.
Okay, Major, just one last thing. If there is one message of encouragement you would like to give veterans listening to this, what would it be?
Well, if you're struggling, we love you. And you should reach out to a fellow veteran or even a family member. Let them know, what you're going through and what you need. Because sometimes, it's just that first step, just, humbling yourself, just ask for help. You'd be surprised how many great people are out there that want to help you through whatever you're struggling with. So I think the biggest thing is just communicate, let people know where you are and what you need. And you'd be surprised at how much help you're going to get.
Well, okay, Major, thank you very much for coming on the show. We appreciate your time and thank you for doing what you do.
Thanks, Don. Appreciate the time.